Well, here we go. Day 2 of a series. I don't know what day we're on. Welcome, everybody. I want to thank you. So we are kind of getting close to the home stretch of a project that spanned a few months in the middle of just any number of crises capped by COVID in the beginning and now continuing on to the effects of it. That's not news to anybody. I'm not going to spend any time talking about that. And so I'll say good morning or good afternoon, then Representative Liebling, I'll let you say hello, and then we'll move on to our agenda. I think we are well underway on the way to finding an agreement that will make sense. Discussions have been amiable. We have a ton of policy that we may get to be able to adopt today. We all understand the gravity of this situation. And I just, in my communications with leadership that I directly and indirectly have heard from both sides, there is a strong will to go home with a product. And I think for those of you who think that $4 billion of spending is a lot, is too little, some of us think it's a great deal of money. And for some of you who think that $4 billion in tax cuts, which is including renter's credit, I think, is too much or too little, that's what it is. If you think education spending at $1 billion is too much or too little, or human services at too much or too little, that is a number that's been agreed on by 3 people none of whom will be in this room today. And so it's upon us now to continue the work of the nature that has been going on in the Senate and I presume in the House, where we are going to find a way to solve the greatest needs of Minnesota's human services sector, health and human services sector. And so that's my hello. Representative Liebling, do you want to say hello? Good afternoon.
All right. Well, Senator Abler, thank you very much for that introduction. So we have, the House and administration sent you an offer last night. I think it's really important to note, especially with what you just laid out there. The House started we had sub-targets, and when we included the targets from essentially 4 committees, we had a target of $2.5 billion or so over the 3 years. And we have, when we got the targets, which we sent you first an offer before we knew what the target would be, incorporating some of your items that we knew were important and that we all agree are important, frankly. And then when we got our targets from leadership, the target that we received is essentially the target that you started with, about $1 billion. But that $1 billion has to stretch to accommodate a lot of needs that your bill didn't even contemplate. So we have now sent you an offer. We sent you an offer last night that meets the target, that incorporates into it a lot of important items, critical needs of Minnesotans. That includes childcare that your bill doesn't deal with. That includes supporting families who are homeless. If you're homeless, that's a pretty critically urgent need. There are critical needs in the state. It includes mental health, which is not in your bill. It includes supporting people in deep poverty, which if that isn't critically urgent, I don't know what is. It includes items to reduce the cost of healthcare, to prepare for future public health emergencies, which I am really concerned that we're heading into one again. And it includes some things we think are very urgent around rebuilding the healthcare workforce that your bill does not. So we sent you this offer, and in the normal course of things, you would respond by sending us an offer. And unfortunately, we have about a day to get this done. And when we heard that you were once again going to bring testimony about the items in your bill, I have to say, Senator, I fear that that is not moving us where we need to go, because we all understand what the issues are. What we need is for your group to work together and give us another offer. And we were prepared, and we've all been working hard on a lot of the policy items, and we're prepared to adopt a lot of policy items, but not when we are now feeling like we're being moved backwards from getting to yes. We all understand we need a bill, and we all understand there are many, many critical needs in the state, including the ones in your bill. We all know that. We all hear from the same folks. We all live in the state. We all have districts. We all care. But you need to come forward now with a bill, with a proposal that incorporates the concerns of more than just the ones, the narrow set of concerns that were in your original bill. And until you do that, we are not moving forward. So we're just very concerned that having a hearing today in which you're again going to bring testimony and just try to, this is, unfortunately, this is going to need to be done. This is a big complex bill or big complex set of bills. And we need to do it in written offers. That is what's going to move us forward right now. They're all now out in the public, and I'm happy with that. That's fine. Have at it. Let's put them out in the public. But we need to be working with each other, not bringing in more testimony, because frankly, the House has not brought in testimony, and we could have done the same thing because there are lots and lots of people who would love to come in and tell the conference committee about what it means to have people be homeless around the state and what it means to not have resources to respond to mental health crises and all of the many things, what it means to have not sufficient resources for childcare, which we know impacts the other things that we all care about too. So they're all urgent crises, and we need to be responding to all of them, Senator. So, we need to get down to it. And that is why we, the House, are not going to, just be here today and just do business as usual, because we can't. We don't have the time. So I suggest that your team sit down together and send us another offer. And if you want to just, sit down and just do the adoption of items that we think we can get to and adopt those policy items, we're happy to do that. But not if it's going to be a, going back to what we already did the last time you had the gavel. Because,
Well, thank you.
We heard.
Well, here's what I think. I think we can go through our offer in quite a short time. There are a few comments I'd like to hear from some of the public that will take 15 minutes or so. We can then review the highlights of the offer as you want to present those, and then we'll move right into adoption. And then after that, we're prepared to recess. I was actually going to ask you, in terms of, we're working on an offer now, as a matter of fact, and when we complete here, we'll sit down. It'll take, a little time. So did you want us to present that offer to you to recess and come back in public, or do you want us just to send that to you electronically into the public?
Senator, it's been sent. There's no need to go through it.
No, we have a new one. No, the new one. I'm asking you for the new one we're giving.
You have a new one.
We're going to have a new one.
Oh, well, good. Because I want you to send that to us so we can look at it. The same way, presenting it in public is not a good use of time. I wish we had the time for that. It'd be great, but we don't. Yeah. We have one day to get this whole thing done, and these are very complex interactions. So
I appreciate
what we would like to do is you send it to us, and we will look at it and get started and see if we need to send you a counter offer. Maybe it's a great package you're sending us and we could say yes to it. But we need time for that, and we're not using the time well since we have 24 hours or so.
Yeah, I respect that. So, but what we have lacked in COVID, and even just, if you remember the 900-page bill that got done in the last minute, I think the public input and visibility has suffered greatly. And I know you've been concerned about that as well. So I think investing an hour this afternoon and reviewing some of that and getting people talk about it is actually helpful to the process, because there's 5 million Minnesotans who are probably interested. Well, probably aren't. That's not correct. There are nowhere near 5 million Minnesotans. There's probably 25,000 Minnesotans who are paying some attention to this stuff. So anyway, so that's what I intend to do. So I think it's productive and it'll be useful, and spending more time together. And too bad we can't be in person, and that's not a pejorative, but it's just too bad we can't be sitting here chatting side by side and reacting to things that nobody can hear us talking about is really helpful. At least by the Zoom thing, we can have some FaceTime together.
Well, Senator, if we were talking about things that nobody could hear, that wouldn't be very transparent, would it? In a lot of ways, this is more transparent than that. So, but the point now is
That's funny, by the way.
we have we have so little time to do this,
Sure.
that we need to get down to doing what has to happen in order to move this thing forward. And we don't need you to present your offer to us in public. You can tell the public where they can find the offer, send it out, post it. Ours are all posted.
Wow.
They've been sent out on our listserv.
All right.
People can read them. And we have a narrative with it explaining what we think are the highlights. You've done that as well.
Sure. So 1 second, Senator Hoffman.
Thank you, Mr. Chair. And as I sit here, having listening to the conversation, I'm constantly reminded about when Ramstead said that it's about focusing on what's the important piece here, right? And leaving our personalization out of the argument. And I think it would be important for us as we look at the critical needs that are sitting in front of us due to the last couple of years, and knowing that those critical needs, if we don't do something, there's going to be a systems change within the state that's going to just have some really bad ill effect, right? So I think it's important that we hear from the folks that you have listed, to talk today, Senator Abler. I just am saying to you that I think it's important that we hear why it's such a critical need for funding to go to help pay for services, to help pay for, to keep nursing homes open. But by the way, if a nursing home closes, I don't know if you know this, Senator Abler, but of the Medicaid system, right, there are 15 mandated systems in Medicaid, right? Nursing homes is one of them. So what is the fail-safe, or where is the safety net that occurs? And I think it's important that we hear from folks about the bill that we're talking about how important it is to the state of Minnesota, and how, if something doesn't happen, what's going to be the end effect. And so with that, I just wanted to say I look forward to the people testifying, because I think it should be a public discussion. This absolutely should be a public discussion, right?
Well,
when you have
I'll tell you what.
46,000 senators.
Just 1 second.
No, I'm just making a point of reference.
He's finishing up. Then.
Yeah, you got 46,000 openings, and you got the highest amount of people 65 and older in the history of Minnesota right now, and the Medicaid cost is going to be higher and higher. So I think it's important that we do that. So I just want to say thank you.
Representative Liebling.
So I was just going to say, you know what, Senator Hoffman, you just said stuff that we've all heard, and I'm not debating it with you. There are a lot of needs, and if you want to hear from testifiers, you want to sit down with those folks, and you need more information from them, please be my guest. But in terms of moving forward, an agreement between the House and the Senate that actually tries to get a bill, that actually gets a bill that meets at least some of the needs, if not all of them, that we need to do in a little different way. And so I'm going to hop off now, and I'm going to just ask you again, the Senate team, to please get us that offer. We will work on it just as quickly as we can, turn it around. And, if you want to have today another, I don't know how it would exactly work, but we can talk about when we can get back together and just adopt the stuff that we agree on. And, we'll just get together as soon as we can to adopt things and keep putting it out in public, and that's how we'll proceed. So thank you so much, and look forward
And
to
we'll be
hearing from you soon.
So you're very good. Well, let's proceed. Mr. Albrecht, would you please, just in a brief manner, please go through the changes that were in our offer, and maybe if someone wants to let me know if Mr. Berg is going to want to go through the House offer after a little bit. So, Mr. Albrecht, just briefly, and just the things that we changed, that you don't have to show where we lined up, but just the changes that occurred, that would be great. Thank you.
Mr. Chair, do you want me to share the document on my screen so folks can see what I'm looking at?
That would be amazing.
Okay, so this is the Senate's first offer that was sent yesterday, and it's compared to the House offer that was prepared before the target was released, and that was sent to the Senate on the 14th, which was Saturday. And the first item in the Senate's offer is on line 8. It is highlighted in green. And this is a matching up to the House position on the American Indian Child Welfare Initiative planning for the Mille Lacs Band. The next proposal is on line 17, accepting the House provision for the ombudsperson for childcare. You only want to talk about the changes, right, Senator Abler?
Excuse me, I was distracted. What was your question?
You only want to talk about the changes, or do you want me to mention that, like on line 24 is the Senate's position for the FAME program?
We'll just mention what we changed in the offer.
Right, okay.
If there's a change, point it out. Not where we line up. We're just trying to, we do want to move along, so.
Yeah. So, well, we do, anyway, line 37 is a change to the Senate's position that also aligns with the House for the residential settings closure prevention grants. On this page, on line 45, this was a Senate position that after the Senate's bill was released, we received new fiscal information from the Department of Human Services. And so though it was a Senate position, the change was matching up to the House, which had picked up the revised or corrected tracking for the MAEPD premium reduction. Line 45 is highlighted because it was one of the places where the House and Senate offers lined up. That's also true down there on line 77 for the Employment Exploration Service-Based Wage Index is a place where the House and Senate line up. Excuse me. The next change is on line 80 at the very top of this page. The Senate agreed to the House position on future PACE implementation. On line 83, the Senate's proposal was to accept the House language for the elderly waiver rate framework, but to revise the House language to be equal to the 3-year Senate funding amount. In the middle of that page on line 107 is a change to the Senate's position of adding some money for the Safe Harbor Grant Program. On line 117 is a place that was highlighted to indicate that the House and the Senate matched up on that proposal for MA coverage for children's hospice respite. On line 121, again, the House and Senate line up on that proposal to allow driving individuals to their personal appointments for PCAs. Line 122 was acknowledging that the House accepted the Senate position on the enhanced rate for high needs PCA. Line 123 was indicating that the House and Senate matched up on that proposal for PCA hours from parents and spouses. Line 129 was the Senate accepting the House position for MA coverage for seizure detection. Line 136 is the Senate accepting the House position for children's residential crisis standard. Lines 142 and 143, well, 142 was actually not in the Senate bill, but the proposal was to include it. and 143 was in both bills. On this page, on line 191, the Senate accepts the House position for the Palliative Care Advisory Council. On line 311, the Senate dropped its interaction between the general fund and the healthcare access fund. And on lines 338, oh, it looks like those are numbered incorrectly. Anyway, the Senate dropped its proposal to increase the MFIP earned income disregard. And I believe that is the end of the offer sheet.
Well, that's very helpful, and thank you. And I hope that it's obvious that we are trying to move. I just want to point out to the public, which is part of why I was hoping to have this meeting, is that the House did make I believe, a private offer to us based on their target, which is actually, if you look at all funds, just a few million shy of $3 billion. And they came down by, what was it, Mr. Albrecht, 130 million or something. And they accepted a handful of our proposals, going in a good direction. I thought that was very nice. But the target was not known at that time, and so that was nice to see what effort they made. And so really, so that was not, in my opinion, if you remember Senator Berglund, anybody remember her? When she would be dealing with Representative Huntley or Bradley, that was always entertaining. But so she would, if the target was a number, she would make the other group bring in an offer that balanced the money with their offer. So if they were higher than her, she made them cut it down or raise it up, whatever. So then you'd have two offers you could actually go with, not pick this and pick that, if you remember that. So I guess I kind of remembered that in my mind, and so I didn't think that an offer at $2.8 billion, all funds, was really the same as what we had going at $1 billion, 1.7 million. Then we had some TANFs that was a little higher on that. So, and so as I looked at the agreement that I saw, I could not see it because it's private, but so I read it on Twitter, and I read the words, and it said 1 billion for HHS, 1 billion for E12. It did not say 1 billion general fund. It said 1 billion. And if you haven't noticed, spending is a big issue with some people in this place. So we've been working off 1 billion. And I do have to apologize. The offer that we brought was 1,900,000 because we forgot the SGSR fund. And so future offers will be balanced. If you notice in this offer, sadly, I took out the TANF proposal just because we just weren't doing TANF. And I do want to remind folks that there's a lot of room for discussion. And at the grand scheme of things, I'm not sure if anybody in the world cares about TANF. So maybe there's somewhere to go to get a deal done. But if a billion is a billion, then it's a billion. And so that's what we tried to do, to show some movement in our first real piece of paper. So let's say we have only a billion, and that was why we moved as we did. But we did take up some of the tribe stuff from Mille Lacs. I think Mille Lacs being independent with their human services work is amazing. I think it was 2012 we were able to make White Earth independent with their human services, which I think is a really commendatory thing. I heard the concern from the commissioner about youth and suicidal youth in ERs. We picked up the language that I thought, the money that I thought went with that, and a few other things. But clearly this is not the final offer. We're working on another one. But I think it's in your first cleaned up offer, you don't get rid of the things that are the most important. And that's true of their second offer as well. It's very clear what their priorities are. And I don't know if we'll have a chance to go into the Senate offer, the House offer as well, but if you look at the all funds spending in that, it's 1.318 billion all funds. And so, you know, that seems like a number different than what we're talking about. And if Senator Representative Liebling were here, I would ask her to comment about how she thinks that's the same as a billion. But, and then, so we're wondering if TANF and Healthcare Access Fund is included. And it's a pretty strong position of our leadership, and we've been led to believe that it's a billion is the billion. And so Certainly through negotiations, that can be changed. And if we need to, I want to do some business here. Anyway, so any questions for any of the members who are present about the Senate offer? All right. Anyway, so then, and so the point I'm trying to make, well, that's so that if Tariq, if you want, are you here in person or are you? Yeah, come on up, will you? And so I don't want to belabor this, and you were here before, but at the end of the day, what we put forward on this bill, on these pieces of paper, actually has to work. How many times have we passed something thinking we were doing a good thing? It didn't work at all. It was horrible. We have to come back and fix it. Like, don't implement it, please. Do you remember some of those? There's been plenty of those. And if we think there's some industries in critical status and the proposal we're going to agree on doesn't work to fix it, we need to know that. And I wish, and so I got in trouble with Representative Pinto saying things were fine, and he didn't mean that, and I didn't really mean that either. But my question that I would ask Representative Liebling if she were here, is this going to work to solve the problems? And so, however they want, and this is not a way to impugn the House. I'm not going there. We got to do business. And but I'm very convinced about the four sectors we're going to hear from, and just in only a few minutes, not to belabor it. And perhaps we can, get back on track a little later. Anyway, so Mr. Menesi, you told us before with some very compelling testimony about how you're unable to fulfill 44% of the rides, and you're about ready to go out of the business of providing any rides, as are many of your folks, and just doing private pay. And so you can have a few minutes to describe what you think of where, or just, I don't know. I didn't give you a script. Just say whatever you like, and you know what we're talking about, so thank you.
Yep, most definitely. Thank you for your time. I'll keep it significantly briefer than the previous testimonies due to how sensitive the time is on everything. So in summary, the Senate funding rate increase is for a 17% increase. Non-emergency medical transportation have not had a rate increase in a decade. So that's 17% over a decade, which averages to 1 or 2% a year. So we have a lot of lost time to make up for. Okay, the House is proposing we cut that rate increase down by 80% for just 3.5%. So over 10 years, you want to give us 3.5%. That's simply not going to cut it. So if the Senate full rate increase does not pass, we're going to stop fee-for-service going forward at the end of this month. And that's going to be statewide, and all the other non-emergency medical transportation providers have echoed the same sentiment. Okay, so in the last two testimonies, I talked about our three biggest expenses, which is payroll, fuel, and insurance. All of that doubled over 100% since we've had a rate increase. So the top three expenses to run the business doubled in the last decade, yet 0% rate increase in the last decade. It's impossible to make that work. All the providers are subsidizing out of their own pocket to continue operating, okay? This is a federally mandated program that the state has to provide transportation, yet the state is dropping the ball and has for the last decade. And the Senate here has a proposal to barely make ends meet, and the House wants to cut that proposal down by 80%. So enough is enough. At the end of this month, we're going to stop all fee-for-service if this does not pass. One thing I haven't talked about is our fourth biggest expense, which is our vehicles. So we have 10 wheelchair vehicles in the metro here. 5 of them are currently off the road, okay? They're off the road for blown engines, transmissions, electrical issues called the TIPM, leaking head gasket. We service everything through Mobile Auto Rescue and Greg and Jim's. We can show receipts, we can show pictures. It doesn't sound like anybody's interested in seeing that. But if you want it, we can show it. I averaged out on a spreadsheet our vehicles just in terms of year. The average wheelchair van is from 2013 and a half, if you average it all out. The average vehicle has 300,000 miles on it. Some exceed 400,000 miles. Now, you might ask, how does Dodge van have 400,000 miles? Well, we have to replace the engine approximately once a year because the drivers put about 50,000 miles on it a year. And the alternative to replacing the engine on a wheelchair van is buying a new wheelchair van. That is $50,000 for a new wheelchair van. Okay, so the Senate proposal in raw dollar amounts is $18 million for a rate increase here. If we, just as one company, upgraded our 10 wheelchair vans, that's $500,000. That means that entire proposal is good enough for 36 companies, just 36 companies to upgrade their vehicles only, not accounting for pay increases, fuel, insurance, and not accounting for the hundreds of other transportation providers. So this bill is the absolute bare minimum. I have a lot more to say, but I'll keep it brief. This bill is absolute bare minimum, and thank you to Senator Abler and Senator Hoffman and the Senate for having our backs, and I really hope the House rights the wrongs and agrees to take this portion of it.
Thank you. Briefly, Senator Coran.
Thank you, Mr. Chair. And for the speaker or the testifier, what would happen? Can you go to the details? What would happen if we adopt the House position and cut that funding or don't provide the additional funding?
Well,
Just briefly, Mr. Moore.
Yeah, the irony in this is by less funding, the most vulnerable members are who get hurt the most and the quickest. We start by cutting our wheelchair vans off the road. These are people that can't order an Uber to get to their appointments. They physically cannot get into the vehicle. And then we start from the metro, and then you hit the lower income areas, and you kind of chip your way to private pay, who are people that do have the resources and the funds to be able to pay the fair market value, which is 2 to 3 times higher than the state.
All right, thank you. Well, that's helpful, and the only point I'm trying to make here with this one and the next people is it has to work. I don't think $1 billion in this bill is a number that's sufficient to handle every need of the state. It's barely enough to handle the most urgent critical needs of this sector that we're talking about with this long-term care and the transportation, et cetera. So but we can't put a proposal that we go home with that makes it collapse. I don't know why. That's hard to say. Anyway, so Mr. Morty, you were awesome. Ms. Kendrick and Mr. Bernander, are you here in person or are you Zooming? We're going to move to nursing facilities. Are they both here in Zooming? So Ms. Kendrick and why don't you go first, Shelley? How you doing?
Hi.
Thanks for being here. And just a couple minutes. We're well aware of everything. So just the summary. And I personally don't think even the Senate position is going to get you out of the woods all the way, but that's what we're trying to talk about. So thanks.
Thank you, Mr. Chair and members of the conference committee. My name is Shelley Kendrick, and I'm the CEO of Ecumen. We are a nonprofit aging services provider across Minnesota. And with due respect to the House priorities, I'm speaking for one of the most critical needs. And as you know, many long-term care providers, they're turning away vulnerable seniors because of not having enough team members to care for them. We need the $358 million at a minimum to increase wages to keep our current workforce and to attract new workers so we can take care of every Minnesota senior who needs help. Without which, we will see many of us close our doors. And that means our Minnesota seniors will have to find access elsewhere, away from their family and their social support networks. So thank you, Senator Abler and the rest of the Senate for your position and looking out for our vulnerable seniors.
So maybe, Ms. Kendrick, you've been around very short while. Since you've been around a while, that might be not coming off the right way. So I know there's some money coming in the next cycle for you all, and significant money. But all the things that you and your contemporaries have said is based upon knowing that money is coming as well. Is that right?
That's correct. That is correct, Senator.
Yeah, all right. And so can you just give me an opinion talking about with the money the Senate has, and I'm here to really focus on, our stuff, and I really am not trying to, this has just gone a little weirder than I thought, but with the money the Senate has in its bill, are you guys going to be like rolling in the dough and you'll have no troubles ever again and you'll find all the help you need, or is it going to be just still not quite as dicey for you?
Thank you. No, it is going to be a beginning for us to help us get out of this situation that we're in. It is not going to solve all of the problems, but it will help us with our wages to at least keep the workforce we have and potentially attract some new workers. That's what we would like to use the money for.
All right, well, that's very helpful. Any questions from members? All right, thank you so much. Then nice to see you again. Mr. Bernander, are you there? Are you online as well? And just briefly, so just don't repeat what the other people said, but just to the same question, especially like if we get the Senate money, is it going to be great? How much less can you do with and still be okay?
You know, I think that the trouble that we have is you've got other sectors out there that can increase their costs for, you know, to go get a burger and increase the cost there. They can pay their staff based on that increase that we feel. Our nursing home side, we're reimbursed 15 to 27 months later for costs that happened prior. And so we really can't anticipate what the market is today. And so we can't compete with today's changes. You know, so, and we look at what our expenses have been over the last 2 years. You know, we've increased wages 14 to 15% over the last year and a half. And that's just to remain competitive with the other job sectors out there. So this funding would have a significant impact on our ability to recruit people that are in the mode to care for people, instead of needing to decide I can go over there and work without a purpose, and they can come here and work with a purpose for us.
That's helpful. Any questions? All right, that's really helpful. Thank you so much for coming. Mr. Burdick, are you there? Who from the department could comment on the department's view of this, since we have a little time? Could you have someone from the department comment about how you kind of came to think that this number was, in the narrative, you seemed like that's going to be a helpful number. Mr. Burdick, or who else is here? Mr. Pollack, maybe, are you there? Or if the commissioner's on, perhaps they could comment, please. So, Mr. Burdick?
Mr. Chair,
Yeah.
they're not on.
They're not on.
They're not on the Zoom.
Really?
Correct.
Oh, okay. Senator Coran, I don't know. I don't know, maybe they're having some technical problems. But anyway, if, I don't know, but I would really be interested to have them comment about that, because they were pretty insistent in the narrative that, anyway, so if they want to, Mr. Yates, would you see if they're having any log-on problems? Maybe they don't have the link, but if you could just send them the link again, I would like that, and tell them we have some questions for them. Okay, so let's do home services. Mr. Adaranki Morty, I think I just made your name horrible. Are you here in person or are you online?
On Zoom.
Hello there.
Hi.
Welcome. Hi.
Hi. Chair and committee members, my name is Aderonke Modi, and I'm the president and CEO of International Quality Home Care and PCA. Our organization provides PCA and skilled nursing care. Our organization is acutely aware of the rapidly growing number of Minnesotans who, without access to home care services, will have to turn to more intensive, expensive, and currently overly stressed facility-based care, such as hospitals and long-term care settings. We know facility-based care is not the preferred option for most Minnesotans, and our state budget cannot afford to provide that more intensive level of care to all who will need it. So our organization works hard to provide needed home care-based care. While we appreciate the past investments made in home care, the current medical assistant reimbursement rate for needed home care services simply do not cover the cost of providing the services. The current low reimbursement rates make it extremely challenging to pay a sufficient wage, which means that those in need of services aren't able to access them or are not able to get all needed hours of care filled. We have a situation, we actually are based in Rochester, and we span about 60% of the state. We provide down to Waddington area in rural areas. And we have a situation, not one, not two, but I just want to mention a particular one. She's 30 years old. She has MS. She has 4 kids. The husband is fully staffed. The husband has a full-time job. But the husband, despite the full-time job, still provides 30 hours of the hours given for PCA to provide the care. And she has 4 children. So the husband is not able to also take care of those 4 children. And of course, she cannot do anything because she's wheelchair bound. And they live in a small rural area of about less than 700 in population. We've contacted, caseworkers have contacted different agencies to see if they can staff it. Nobody can. And we realize it's all because of the wage. Nobody wants to drive there because of the gas. Now, for our own particular agency also, we provide a skilled nursing care. Right now, as I'm speaking to you, I met with all our staff and we've decided we're no longer going to take MA clients if the MA clients are not in town, because we had to increase tremendously our rates, the wages that we pay our nurses. We are a relatively small agency, but because of competition and the big agencies and what have you, we have to increase, but the salary wages and the driving distance and everything, the $80 per skill cannot cut it. This lack of access to needed home care services results in children and adults remaining in the hospital unnecessarily when they should be discharged. Or individuals have to move to more facility-based settings when they could remain in their own homes if they had access to home care. As an example of the very need in the area of home care services rates, just recently we learned that another home care provider, specifically 3 Links Home Care Link will be closing. They will be closing. They are home health agency in Northfield area. They are closing due to several factors, including a complex government reimbursement model, unprecedented workforce challenges for small home health agencies. Staff from the organization shared that the decision to close was a very, very difficult decision and made with a heavy heart. They reported telling their staff was not easy, but telling the clients was worse. So if we as a state value supporting older Minnesotans and those with disabilities and complex health needs to remain living in their own homes and avoiding more expensive care, we must make these services more accessible. The legislature must take steps to adjust reimbursement rates to address this lack of access to these critical services. Please take steps this session to invest in home care services reimbursement rates and support more Minnesotans to live as independently as possible in their communities. Thank you very much.
Well, thank you, Ms. Morty. That's, and we didn't actually have any testimony from the home care people before, and I'm glad you can come today. Do you know about in your industry, you must have some friends and so on, how many of them are like in great shape and how many of them are rickety and at risk of closing? Just given, if nothing changes, where are they at, do you know?
If nothing changes, I can honestly guarantee that small agencies, especially, which of course has the highest percentage, are going to close. We right now, we are running negative. And it's very, very difficult. We had to make a lot of decisions. Next week, I'm meeting with some of our staff. As I'm talking to you right now, we are going to be asking some of them. I mean, we just have to find a way to do, we cannot do this, we can only take these, we can't take MA clients. Like I told you, we've already stopped taking MA clients if the MA client is within 10 minutes drive. So because by the time you put the wages, by the time you add all the benefits, the $80 is just not enough. The PCA is $19.60 for regular PCA, non-complex PCA, but that is if the hours is less than 10 hours a day. Even with the choice, we have people come to us. The families don't even have friends or neighbors that can do it. So they're asking us to please advertise on their behalf, even though it's choice and they have to look for their staff. So just because from July 1st it's going to be $15, even with that, is still a problem. We have hours, thousands of hours that we cannot cover. As I'm talking to you, every quarter we assess it. It's just impossible to do.
Wow. Wow. Any questions from members? Well, Ms. Morty, that is, so if you can't take an MA client, where do they go?
They probably will go back to the hospital, which is more expensive, or some family members will have to quit their jobs to take care of their loved ones, or some might end up in nursing homes that's already, also having difficulties with staffing. So at the end of the day, honestly, I don't know. But right now, honestly, as I'm speaking to you, we met about 2-3 weeks ago before I traveled that we cannot sustain on MA. We can't.
That's amazing. Anyway. All right. Thank you very much. So we just have one last one here, group home stuff. Carrie McCann and then Mary Jo Busian. So who wants to go first? Oh, we got a whole crew there.
Yes, hi.
Oh, it's a panel. We got a panel. That's pretty cool. It seems like, we bragged about, Senator Hoffman, we bragged about having, some of the highest viewing of anybody. Yes.
That's correct, Mr.
I'm just
Chair.
surprised how many people are not on this call that are usually on this call, that work for the state. Anyway,
Your numbers just went down. At one time you had more than, you had more people viewing your committee hearing, Senator Abler, than the U.S. House had committee, watching their committee hearings, so.
Yeah, that was funny once, and I think it's still pretty cool back in the day. But this is the end of the session time, and we have a bill in front of us. We have some critical needs. We have $1 billion to spend to make a difference. Yeah. And we've heard from 3 groups that are just, it's not going well. And I just think if you're proud of your bill, you should be here to defend it. That's all. I wasn't even going to say that, but I was just shocked when I asked for Mr. Burdick, who's the face, just the messenger, and other people, and there's not one DHS person on this call. Yeah. Not one. And there's not one MDH person on this call. And so, yes, time is short. This is a big deal. If we don't do this well, people will die. The costs will go up. And we cannot have that. Nobody in this room or the people watching or people who would like to be watching want that to happen. And I don't want to see people who are homeless come to harm, people who need childcare and not get it. Yep. But the only way that happens is we all stay in the room.
Correct.
Anyway, so maybe I went too far, I don't know. But
no, you didn't.
Anyway, to the panel, welcome. I don't get mad that often, and I'm just personally upset. So I'm going to just sit down for a second. And so the 3 of you, welcome. And just kind of in brief, so there's I forget how much money we have in our bill for you, pretty much. Although not a lot, not $1 billion or anything. It's a few hundred million, 300 million maybe. Can you comment about how much will be rolling in the dough when our bill gets implemented and you're just going to have time for pizza and custard for all your staff? Go ahead.
I would love to comment on that. I'm Kari McCann. I'm the executive director, and thank you for your time, but I can't comment to rolling on the dough because that won't happen. What will happen if the Senate's side passes is we will be able to at least breathe slightly easy, not hold our breath like we have been over the past few years. Great River Homes is a nonprofit out of Wabasha County. In our prime, we served 75 plus individuals throughout Wabasha County, just out in our community, as well as provided in 24-hour supports to individuals in their home. Now we're only able to serve 16 individuals out in our community who live outside of Great River Homes, 24-hour settings, and 33 people in setting. And that's because of the staffing shortage that we have. And the staffing shortage is directly related to the wages that we are able to pay. The wages we're able to pay is directly related to the reimbursement rates that are bestowed upon us by our legislative government. So that's what I'm here to testify in regards to. Great River Homes is on schedule to possibly close our doors by 2024. This will impact thousands of Minnesotans, not just in Wabasha County, but throughout the state of Minnesota. So this is a critical issue. Great River Homes is one of the larger employers out of Wabasha with a large quote unquote we hope to have 99 employees. We don't. We're down to about 63 employees at one point. But because we've increased our wages to a phenomenal base rate of $20 per hour, in which we are only reimbursed $16 and 5 cents an hour for awake, and $10.08 an hour for sleeping or overnight supervision time. You can see how we are quickly receiving a deficit. Our March financials show that we're running in the deficit of $57,000. So unfortunately, Senator Abler, I can't say that we'll be rolling in the dough, but at least we'd be able to sustain services.
Thank you very much. And so specifically, do you know, anyway, so the money we put in the bill, well, it's not, you know, it's hundreds of millions, but that will buy you time, basically?
Yes.
All right. So then, I don't know if all three of you want to talk. We were trying to keep it short, but since it's just us now, you might as well have a chance to say what you're going to say, so at least it can be out there for the TV audience, which is Senator Hoffman is. I can't even tell jokes now. I'm just.
It's not. You're not at that point, Mr. Chair.
I'm just not okay.
No, it's not. Funny
Anyway, so who's Ms. Busen, and then the young man might want to say something, but go ahead, please.
Thank you, Senator Abler. My name is Mary Jo Bouchon, and I want to take this opportunity to share our story regarding our daughter, Katie Bouchon, who lives in a residential setting and receives services. Katie has been living at Great River Homes for 5 years. During this past 5 years, she has experienced exceptional growth and independence beyond what we could have ever imagined her receiving living outside of our home. You may recall the handwritten note that Representative Barb Haley read during the May 4th debate on this topic. From a very young age, we dreamed that Katie would have the opportunity to experience life outside of our home, just like her sisters do. We believe every individual deserves that right. Currently, that living arrangement is in extreme jeopardy. Katie is nonverbal and completely reliant on outside 24-hour-a-day care. In March of 2020, at the start of COVID, we were unable to see Katie for her routine weekend visits. This fear and the fears and sleepless nights of how she was handling this lock-in was heartbreaking. Weekly visits had been how we were able to see how she was doing firsthand. You can imagine what we were experiencing. Our family was suffering. I spoke with my employer about taking a leave of absence, and between myself, my husband Dennis, who's here with me today, and Katie's younger sister, who was in college, we devised a plan to bring Katie home indefinitely. Fortunately, the following day, restrictions were lifted, and we were able to see Katie on our weekend basis. We were able to personally witness how Katie was not only surviving, but thriving and doing great. This positive outcome of the 12-week stint was a direct reflection of the services provided by her DSPs, and we are forever grateful. In most people living in a home across the state, most people living in group homes across the state do not have family that could bring them home for the required care if the group homes close. Many have aging parents or no family at all that could provide the necessary care. If Great River Homes is unable to employ the required care providers, how are we going to provide care in our home for just one individual? What will happen to these individuals? What kind of disruption to the families, jobs, and financial lives will this cause? What level of care will they be able to receive? These people deserve to be cared for in living arrangements that is independent of parents or guardians. The progress that we have made with community-based living is critical. We cannot go backward toward institutional living settings. When I hear about individuals who have moved into emergency room garage bays because homes have closed that they have lived in, and it's taking 8 to 10 nurses to provide the care, I can only imagine the cost that is providing our state. Do you or any of your family members, friends, or loved ones living with a disability? If you do, I trust you know the urgency in supporting this bill. The support of DSPs is critical to provide the positive life experience that everyone is entitled to. The great state of Minnesota needs to recognize how many this will affect and the trickle-down effect. We are begging for your support of this bill. Thank you for your time today. Dennis and MJ.
Well, thank you, and thank you very much. I don't just know what to say. Did the young man sitting by you wish to say anything, or is he just there to?
I'm just there for moral support, Senator.
Yeah. No, I appreciate that, and frankly, I need it right now.
So Senator, this is Kari McCann.
Yeah, please.
We have a choice here. We can either choose to support disability services, or we can choose to accept the fact that we'll be shifting these people that are currently receiving services into hospitals, criminal justice centers, and homeless population. Something that Representative Liebling said, we want to support our homeless population. We're going to be increasing that substantially if we don't do something this session. Each of these services costs much more than the disability services that we're talking about and advocating for today, where people are served in the most person-centered ways and that assist people to live their best lives in the settings that meet their needs.
Well, thank you very much. Any questions from members for any of the group home folks? And so, well, Ms. McCann, you certainly talked to a lot of your colleagues. Do you know how many group homes and services like yours are in danger of closing if we don't do anything?
Great River Homes is on track to close very quickly. And that's all 8 of our houses. We have 2 in Lake City and we have 6 in Wabasha, serving 33 individuals. And then outside of those houses, we also do in-home supports where we go into family houses, family homes, or the person might be living independently in their community site, so their own apartment, and we would be terminating all services with them too.
And how many people is that?
Right now, it's only 16. There's waiting lists for all of our services.
Wow.
Too.
Well, that's just really sobering, and used to be, I mean, I didn't mean to drag this out, but Senator Hoffman and, you know, back when Representative Goodnow and I were doing this, we were so happy to unlock the waiting list, and you're in the waiver, you're good to go. And now being in the waiver doesn't mean anything, because there's no place to go. You're gonna lose what you got, and it's not even a nursing home to go into, because they're on the rocks. So anyway, well, I do appreciate that. I have a thought, but Representative Albright, did you want to offer a comment?
Wait,
Oh,
I can wait to the end if you've got more
oh,
business to take.
we have no more testifiers. I'm just going to announce my plan for the rest of the day. Actually, I'm going to announce to see what the plan. I'm going to see if anybody will get back to me and see what they want to do. But go ahead. You might have to just take your thing, and then we'll, if it's appropriate now.
Well, I appreciate, Mr. Chair, the opportunity to let you know that there are House members at the table right now. That'd be me. And we worked very hard over the course of the last several months to put into form issues that I think are very, very important. I didn't vote for the House bill. And there was a number of reasons why that, but I'm sitting on this committee, much like the rest of you, and much like the rest of you out in the audience, because we're at a watershed event in this state when it comes to the most vulnerable amongst us. And I say that not only about the people that are being served by the people that we've just heard about, but also the communities and the organizations that are most vulnerable. You can say what you want over the last course of years in couple of years in terms of what has transpired. But we have put people at risk. There is no going back for these folks. A good friend of mine and a mentor of mine used to talk about the hierarchy of need. And when we put the budget together, particularly for HHS, at the pinnacle were those that needed it the most. Mr. Chair, with whatever time that we have in this conference committee, in this legislature, it's incumbent upon us to get something done for those. Some might say, well, we already have a budget. That's fair. But there are needs that have come up in the course of the months after that that have not been addressed. When you take a look at the people that are providing care, when you look at the people that are in need of care, something's got to give. Whether we have till the end of today, whether we have until the end of tomorrow, whether we have until the end of Thursday, this conference committee is charged with looking after those that can't take care of themselves. I wish that that would be the centerpiece of our conversations. And with all due respect, we can talk about positions, we can talk about, you know, well, we did this or we didn't do that. But at the end of the day, Mr. Chair, I know you share my heart on this, but people need us to stand up for them and provide assurance that they're going to be taken care of. I'm amazed that the very government that we were elected to work within is competing with the people that we are here to serve. I think that's shameful. When we worry more about studies, when we worry more about task forces, and we worry more about elected boards than direct support for those that can't provide it themselves. That is our charge. That is our obligation. Nothing more. We have time, we have the passion, I urge both sides to get it done. Thank you.
Well, thank you very much. And that's why we're here. I want to thank the testifiers. I think their testimony was just reinforcing that the Senate position is not bloated. It's not excessive. It seems like the bare minimum of what we need. And I was hoping to be persuaded differently. Maybe I knew the answers to the questions, but I would have been interested to say, no, we could handle, half of that, or, a third, or something less. But I don't know that we can on the matters of nursing homes, on group homes, on home care, and the transportation. I don't know how we do much less. And my efforts have been and will be in the next offer we bring out to find ways to lean up other areas to handle some of the interests of the House and the administration, and and I'll call them priorities. Everybody has priorities, and we'll try to honor ones, and some of those will be, ones that I don't hold quite as hard, but that's as high, but that's the process. And so my text machine is not replying to, no one's replying to my little text. So my intention was then to look at the House bill and let them go over their bill and explain why it's an adequate bit of funding for what goes forward. But I'm not going to take the House's bill and line by line and criticize it. That is not the purpose of this meeting. But I can tell you that I'm really proud of the Senate bill, Senate position. We had 61 votes in a bipartisan way, and the only concerns were just some little petty things on the other ones, other votes who voted no. I think we're on the right track. I know the administration cares about this, and I know the House cares about this. So, unless I get a text from somebody in the next, 3 minutes that we're going to hear from the House on anything, we're going to, I don't know how you recess a meeting, you never actually had a quorum to call into order, but we're going to recess the non-call to order meeting, and we're going to go work on an offer. And if we can get it done timely, we'll bring it back to the non-recessed meeting, to the recessed non-meeting, and reconvene the meeting that will be here and see if the House wants to come. I was going to do it privately, that was their request, but just since this is going like this, I think people need to see where the Senate's going to go. And this is not, Senator Hoffman, this is not the Senate has to win. This is like people like Mr. Manisi and Dr. Morty with the families and the mother, Miss the Bouchons, that they can have their kids. That's who's going to win. That's what's at risk about here. It's not about who gets their personal projects squared away. Senator Hoffman, if it wasn't that the system was going to collapse, I would have quit on this topic a long time ago and worked on something else that, some other project that we should reform, some kind of statutes or something. But anyway, Senator Hoffman, I'll give you the last word, and then we're going to make a plan here. I'm waiting for the.
To your point, Mr. Chair, and thank you, Representative Albright, for bringing us back on the focus of why we're here. And in the Senate position, as you're correct, Mr. Chair, 61 is pretty good when you look at it. It's well put together in a supplemental year to fix some things that need to be fixed and stay focused on those critical pieces. And it just absolutely scares me to think about the transportation side, Mr. Chair. You start with, well, we're going to have to stop providing, transportation for people in wheelchairs. Rick Cardenas would be sitting here right now saying to you, that's not okay, Jim, right? I mean, we knew Rick for many, many years, and that would never be okay. And I like what Tony was saying about, at the very top are the people that need it the most. We are at a time where that's happening. And so I just want to say that we're staying focused and stay focused on, people with disabilities or elderly and young children. So thank you for that, Mr. Chair.
Yeah, well, thank you. So we're going to, I think the word is disband pretty soon. We're going to recess the meeting here. We're going to work on an offer. If I mean, I respect the people that hang around waiting for all these offers. We're going to try to get it done kind of soon. If you want to be in person, you can. You can watch on Zoom. You won't hurt my feelings. But I just watched the monitors, and so we fully intend to come back with an offer in a couple of hours. So with that, I guess I can bang the gavel. Thank you.